Hi, my name is Tania Morris. I'm an anaesthetist and a pain medicine specialist. I found out about PCM at a Welfare of Anaesthetists conference that I went to in 2009. I decided to become a PCM provider because I wanted to add another skill to what I'd already learnt and felt like I needed to pursue that even more than what I had learnt in the Part 1 and Part 2 course. And potentially longer term I wanted to make that part of my working life more than what I have at the moment. I think PCM is a great skill to learn because it creates better relationships with not only personal interactions but working life interactions. And I also get to understand myself better and manage myself in situations that are becoming stressful. One of my patients I was treating from a chronic pain point of view not that long ago was an inpatient in the hospital, and the treating team made fairly derogatory remarks about the patient because the patient's behaviour was very difficult, obviously in some distress, not just from physical pain but mental distress. When I entered the room, I first was confronted by the distress pattern of a persister, and I was able to speak to the patient in their language because within a few minutes the patient stopped the distress pattern and continued to listen to me, became engaged in the plan ahead where she had been combative and not trusting of the treating team. And unfortunately there became a pattern of her only listening to me whenever I would visit, but she would never listen to the treating team. What that ended up in was, luckily we avoided an adverse outcome because I was able to convince her to engage in the management plan and agree to a particular treatment plan where if she had not, she would have ended up with quite severe medical adverse event like paralysis from a spinal infection. So the behaviour that she had exhibited repelled her treating team, where I was able to identify it as a distress pattern, not take it personally, and continue to see this lady and try and objectively think of the problems for her medically. I think that was the most amazing outcome I've seen so far. Someone who is brave enough to challenge themselves in understanding their own personality structure, being willing to improve on their self-management skills, so improve their self-awareness and their self-management skills. Someone that's passionate about improving people's lives, caring that people can improve themselves and relationships. Also from improving business environments for the benefit of the people and also success of private enterprise, that person would be very well suited to that role as well. Be prepared for an exciting roller coaster ride.